I'd like to welcome you to today's sort of live webinar podcast. It's such a new format that we've chosen in order to convey such a real experience, whether it's with our platform or with the digitalization of care in general. And today we would like to talk about orthopedics. We'd like to cover innovations in orthopedic patient management and maybe a little bit of a peek into what real-world practice looks like when specialists start using digital technology. So welcome to one of our most active experts, Dr. Zamborsky, but I probably don't have an introduction to you, so I'm going to ask you who you are, what you do.
Of course, thank you, Patrick, first of all, for the invitation. Also for this interesting topic that we can share it with others. For this interesting topic that we can boss it with others. I have been involved in orthopedics trauma surgery for over 20 years and I am actually a university teacher at the Faculty of Medicine of Comenius University, and I am also involved in outpatient practice in a private center as part of my specialization. So we manage the musculoskeletal system in patients, in adults, in children. Within the Faculty of Medicine, we are involved in various projects. One such hobby of mine is regenerative orthopedics, where we try to somehow bring and innovate so that we can improve the musculoskeletal system as a whole. Well, and I've always tried to bring some of these new things and new innovations, including digitalization as well, so new forms of communication between us, between the patient, between the doctor.
Great. So let's talk about what does it actually mean? What does digitalization actually mean, and why should healthcare professionals be involved in digitalization at all?
First of all, the requirement is quite basic. It is to speed up processes and reduce the administrative burden. We all know that health professionals, it is no secret, are overburdened in our country. So we are looking for some other forms of being more flexible. A lot of health professionals would perhaps welcome more working from home, less time spent in the outpatient clinic, that sort of thing. And I had that intention. I mean, I'm using the CLADE services. I can see my patients pretty much anytime, anywhere, when I'm sick or when I'm out of the country. Well, as far as this digitalization for Slovakia is concerned, it is such an open topic. It is very interesting. Which means that I also personally have huge pressures from patients or insights we all have from patients. They try to circumvent the waiting times by contacting us personally or by some acquaintances, and now we are inundated with messages, WhatsApp, emails, where how many WhatsApp messages do you have today? Daily, an awful lot. I just can't filter it. It's all day, it's all night, and you just can't always accommodate those requests. A lot of attachments go in the mail. Look at my highlights, look at my MRs. Cool. One thing maybe we should say is that this is such private sensitive data, including even image documentation that is unprotected. We're listening to GDPR, the EU, and so on. It also has no coordination. Nor does any other such structured transfer of information to the patient work. So it remains such a loss to it goes. So that was probably the main reason why
Those were the problems that you were actually dealing with on a daily basis. Okay, and now let's say you've actually very successfully implemented digitalization. You're using the most functional Hilbi platforms in the practice, and you're even a pioneer in such innovations. We'll talk about that. But how has that digitalization actually simplified the work for you when we look at the day-to-day running of the practice?
Yeah, well, it came out of the fact that I was looking for some other alternative solutions, so more comfortable for me, more comfortable for the patient. So these digital innovations are basically inevitable for me nowadays. So whether it's patient ordering or patient self-ordering, For a term, it is also a triage of requirements. The triage of requirements means that it makes life easier for the patient, for the doctor, so that the patient knows in advance, say, what to prepare before the examination, before the visit to the doctor, so that he or she has all the documents completed. On the other hand, it is information for the doctor to know what to expect, what kind of patient. That is, to be able to direct him correctly. There is a patient who wants to come to me, but doesn't quite everything is suitable for, say, orthopedics. It fits somewhere else. So that patient has to be directed well, and further simplifying my life as well is the upload functionality, or the ability to upload to a personal life ID, or therefore to that patient's cloud where everything is uploaded. No emails, no nothing, all messages. All sorts of things can be uploaded there, and I always have access to it. It's a cool thing.
Do you use that approach outside of the clinic?
Yes, it can definitely be used outside the clinic, because even if I sit down at the computer from the comfort of my home, there are a lot of things that we don't manage to finish during the day. I mean, you can carry on in the evening, sometimes at night, but it's all about how you manage your time. You can get there from your tablet, you can get there from your mobile. These are cool things that are very fast modern. It would speed up communication a lot. And then the other important thing about our clinic is that that automation, that structured channel has taken a lot of the burden of the nurses and the front desk.
Great. I guess we'll talk later about checkups. I'm just going to mention this can be seen on camera. Okay, we'll go over the details. What I love so much is that you actually took it even further, and you're pushing a QR code right into the first medical message to clients directly to book their next appointment and follow up, and with complete navigation. Meaning the patient de facto doesn't even need to know anything about the digital platform, but actually based on the first appointment, and they take a picture of the first appointment, and they already have a complete navigation there where they have what to upload, book, and so on.
Yes, of course. If I can give you an example of that. For example, I don't know, I'll send a patient with a knee injury for an MRI, but I don't know when that patient is going to come back from the MRI, because, you know, the wait times can be a week, but normally 2-3 months. I mean, we can't even make any appointments ahead of time for a follow-up. That's what it's about, actually. Actually, the whole thing, the QR code and the follow-up option, that the patient just scans the QR code. It's automatically in the system. They can log in, and as soon as you've got your test done, which I requested, whether it's in image documentation in a DACOM format and with descriptions of the labs, lab values, everything I need is just there. They have to book on the appointment, and the rest we go maybe outpatient form, but that's what more and more advises me, is just that digital format through the video consultation platform.
I'll soak in a little more. If you have any questions, post them in the chat and we'll address the questions later on at the end. Okay, and Radko, what were the concerns about the rollout of digitization? When you were first getting acquainted, where were those the first time?
Well, that's a historical question. Let's say it's irrelevant today, because
the overflow that it will reach you, because, you know, some health professionals are very worried that digitalization is something that is unimaginable, that we talk about it, that it's difficult, that when you say digitalization in healthcare, it's something that's it's very far away, it's going to complicate my time, I have to learn new habits. How was it for you?
Well, for me, it was basically maybe what you're saying, that those habits and that fear, maybe older generations of doctors and stuff like that, since we're dealing with sensitive data. But one thing to remember is that, look, everybody, we use digital things around us every day in the current format. We have accounts on Facebook, Instagram. We make appointments for hairdressers, for movies and stuff like that. Even as health professionals, we use platforms and things like So as long as you can order food home, you can change the patient's order, video cozies, you're doing great. I also think you don't need to worry. The doctors don't need to worry either. It's very simple, really. You need to get used to some one uniform system. You don't need to get used to a lot of outpatient systems. You just have to go for it. It's just all about will and motivation, in my opinion. Were there any challenges that you faced completely in the early days? In the early days, it was maybe that a lot of these things are like that it actually brings us. It's very much dependent on, for example, by those specialists. So it's basically already, it's such a common part nowadays. I can't imagine it without it, or at least a part of those patients without it anymore.
Okay, I guess let's see what it looks like in practice. I'll highlight some of the processes we've photographed at your place. But just as a preamble, for those who don't know us and haven't come into contact with Hilbi yet, I'd like to introduce the platform itself very simply. Hilbi is a platform that has brought a patient-centric solution for end-to-end patient management using digital technology. That is, it's a platform that can interactively engage the patient in the process of treatment, care, prevention, or follow-up. This means the patient's side arises and interfaces where he can interact with the doctor. That is, he can manage his therapies. Can you pay the various surcharges or the full amount for the amenities? We'll talk about that. He knows how to upload his data. He knows how to keep all his medical documents, and he knows communicate with the doctor in an orderly manner. That is, whether it's post-medical management, whether it's navigation, and so on. Based on that, we can offload the doctors at that primary sphere. That starts from 20-30%, and of course gynecology and pediatrics, where there are more women and so on, up to 70%, where the patient can go completely into self-management, means that he can self-manage, he can do triage, what you were saying, and he can mainly receive teleconsultations and interactive treatment recommendations. But let's take a look at your profile and try something for us.
What to tell, maybe, so that your colleagues also perceive the way you work. So we have the opportunity to see basically such an interactive calendar. It's important to learn how to work with a calendar and organize your time. It has to be said, a calendar of this type is structured. That is, there's the ability to see patients who are booked into the outpatient clinic for a clinical exam, mixing structuring with patients who are booked in, say, for an online exam. The advantage of that online whole or that calendar, for example, is that you don't need to create any link to the online one. Simply, both the doctor and the patients are able to click on a specific date, and just the virtual platform just connects them. We're together on video, and I have to highlight something that even I like, and especially the forgetful ones. I get notifications, and so do the patients. Good Lord, it's chasing us
well
then.
done, well done. Then, of course, there's a preview of the upload. Technically, basically, patients are able to generate their own protected line. This means that the transfer from those CDs is also de facto possible in the facility of some fax copy, because that line is actually protected, confirmed by two-factor authorization, identification, and the patient has de facto access via such secure lines to his cluster. And here it is very important, as you can see, that information or that medical data can be from the big ones to the simple manuals, like taking pictures of medical reports that are automatically digitized. So let's take a look, though. How do you work with that?
I mean, you've shown this now with the example of a patient who, for example, had a clinical examination, that first examination in the outpatient clinic. I mean, me with my back pain. So, for example, I'll specify that I want an MRI, or I'd like to know what else the neurologist thinks about it, that sort of thing. So he'll take those tests, and just when he's done, he'll upload them and plop them into his profile on his cloud. Well, At the end of that examination, he gets that QR code, and then he logs in based on that. When he's done with all that, to me that's info that, yes, we're done, we can move on with the issue. So you can show another slide. That's kind of a demonstration that, for example, a simple report from other doctors in the course of the examination or a refill from another specialist, I don't even, if it's there in PDF format, I don't even have to transcribe it. That's one huge advantage because it really saves me minutes of typing. The system can automatically transcribe the report into D-course. It can transfer the lab results straight into my report, etc. So a huge advantage in saving time.
Let's look at that telecommunications. I have to say that fictitious data is used, or the data is not from specific patients, so as not to jeopardize protected health information. But this is what teleconsultation looks like in real terms.
We give this as an example. It's such a piece of cake. I've gotten used to it. I quite like it. I mean, it's very important to me that the patient doesn't have to go because I've already seen everything else actually beforehand, or sometimes we'll look ahead. I'll prepare for it. Sometimes I don't keep up, so we'll go over it together. What's important to say, I have a patient identified that way. That means that if he is registered in the platform and I can see him I have an identified patient, there can't be someone else there to sort things out for him. I can thus, when I have complete documentation, make a payment based on that participation, make some conclusion of my own, conclude his diagnosis, and then I can draw up actually, or I have to draw up a medical report that makes me full.
And this is where it's very important that by having this video consultation overwhelm you with that data. Is that something that you knew how to use naturalization, or did you have to get used to it?
Content, I got used to it very quickly because of all that data and all that stuff you get in the image attachments. That's what an institution is. That's different data, that's different stuff, different form, different structure. What I like very much about this is that it's laid out in a simple way. It's got some structure to it. We can see it on that right-hand side in that patient ID that I can flip through there. I can look at it. I can open it. I can come back to it at any time.
You also come back to it
anytime.
De facto when you actually leave the ambulance tired and you remember something.
I can look at his old Rangeno against the new one like this, see if anything has shifted, for example, and so on.
Cool, that was interesting. We'll have questions about that later. And just this one already shows your QR code. Already used to be on the screen.
This is such an example, Patrick. You've seen this in the outpatient clinic. Such an example from our medical establishment. Such basically reports. This is the official document that really the patient has to leave with, is relevantly examined. And that QR code is used to, some people ask about it, not all, but some people ask about it. They like it. We teach some of our patients, the ones who are willing to do it, to get used to it. Those are good to work with. It's not going to be quick, but I believe there will be more and more of them.
That is, the patient receives a post-video check because we are talking about the fact that the patient has been examined clinically in the first examination.
It's all those mode measures, it's all that notification so that the patient sees, so that he's got it all figured out, what we've gone through. I'll summarize it for him there. Yeah, exactly. So that he can look it up on his mobile, remind or consult the pharmacy if there's any recommendation for medication.
That's actually sort of a summary either of the regimen reps or
Simple.
those essential facts, so that that patient knows in that day-to-day management, let's say, when they have an intervention where they have to move from point A to point B, that they can see those requirements of yours. Of course. Great, great. I'm still pulling out the Vrengen, and tell us a little bit here. Thank you.
Hey, that's another example or another way to consult patients like pediatric patients, which I have a lot of kids like that, basically 10 to 8-year-olds with pets going in with pain. We'll do an exam on them. For example, I can see that there's a problem there. So there's not much I can do about it. We'll just have to wait it out, or there's some physiotherapy being done. And I can check the events like that afterwards in some horizons, 3 months, 4 months, half a year. But the patient doesn't have to come to me. let's say from Polka Slovenska to some specialized outpatient clinics or to specialized children's hospitals, of which we have only a few. But this way we can comfortably consult. We can put ourselves on video, I'll look at the images you upload there, and we're equipped in 5 minutes with that kind of issue.
It's common in you to have patients who have to travel for follow-ups.
Of course, they sometimes travel all the way from eastern Slovakia to Bratislava. Now they have to deal with transfers, they have to deal with parking.
Here's a general question. I know the answer to that, of course, but the patient has costs associated with the travel and, of course, the window of time that they have to make up